What are some common misconceptions about Marilyn Monroe's death and medication? Marilyn Monroe remains one of the most iconic figures in Hollywood history, but her untimely death has led to numerous myths and misunderstandings. Many people believe that her death was a straightforward case of overdose, but the reality is far more complex. One common misconception is that Monroe was found with a large number of prescription bottles surrounding her. In truth, while she did have some medications in her home, the scene was not as chaotic as many portray it to be. This has contributed to the narrative that her death was a result of reckless behavior, rather than the struggles she faced with mental health and substance use. Another prevalent belief is that Monroe was intentionally trying to take her own life. While there were certainly signs of distress in her life leading up to her death, the evidence does not definitively support the idea that she planned her death. Many experts suggest that her passing was more likely an accident, exacerbated by her use of medications. Additionally, some people think that Monroe was heavily addicted to drugs. While she did use prescription medications, it is important to note that her usage was often related to her attempts to manage anxiety and insomnia, rather than a straightforward addiction. This distinction is essential in understanding her struggles and the context of her death. Lastly, there are theories suggesting that Monroe's death was linked to foul play involving powerful figures in Hollywood. While conspiracy theories abound, the official investigation concluded that her death was a probable overdose, with no conclusive evidence pointing to murder. By examining these misconceptions, we can gain a clearer picture of Marilyn Monroe's life and the circumstances surrounding her death, moving beyond the myths to understand the reality of her experiences.